Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit npteff.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today will be part one of our mini series, and this mini series will be all about ABGs. Now, during this episode, we will be discussing the steps to solving ABGs, but first, let's test your knowledge with a practice question. So the question reads as follows. A 63-year-old patient with a 10-year history of diabetes mellitus was admitted in an acute care hospital for diabetic ketoacidosis. Their arterial blood gas values tested results as following: pH of 7.25, PaCO2 of 40, and HCO3 of 20. So again, that was a pH of 7.25, a PaCO2 of 40, and an HCO3 of 20. Which of the following conditions is most related to these values? Option A, metabolic alkalosis. Option B, respiratory acidosis. Option C, respiratory alkalosis, or option D, metabolic acidosis.
So, all of the above patient presentations are related to option D, metabolic acidosis. If the primary problem is metabolic, the problem on the basis of the relationship is between the pH and the PaCO2. The problem is classified as uncompensated if the reported pH is outside of the normal range and the reported PaCO2 is within that normal range.
All right, so arterial blood gases can be extremely complex and challenging, especially during the NPTE. So let's now spend some time reviewing the steps to solving ABGs to help make sure you get these questions right in the future. So we like to break this down into 3 or 4 steps. Our first step is to always look at pH values first. If our pH is normal, which is within that 7.35 to 7.45 range, then we know this is compensated. Now, if our pH is not normal or abnormal, so outside of that range of 7.35 to 7.45, then we would consider this uncompensated. Now, our second step is to look at PaCO2. If our PaCO2 is normal, so between 35 to 45, then we can say our answer is most likely metabolic. Okay? Now, finally, if we're looking at our third step, looking at our HCO3, if our HCO3 is normal, so within that 22 to 26 range, then we can say our answer is respiratory. Now, I want to take that one step further and realize that when we're looking at PaCO2 and HCO3, we also should look at our relationships between pH values. So what I mean by that is, there is an indirect relationship between PaCO2 and pH, while there is a direct relationship between HCO3 and our pH, which David will discuss further in a moment. But the last thing, which we can use as our fourth step to remember, is that if all of these values are abnormal, so if our pH is abnormal, if our HCO2 is abnormal, and our HCO3 is abnormal, then we would classify this as partially compensated. Okay? So again, just in summary, when looking at pH, we're looking if it's normal, it's compensated, and if it's abnormal, it's uncompensated. If our PaCO2 is normal, then our answer is most likely metabolic. And if our HCO3 is normal, the answer is most likely respiratory. And then if all three are abnormal, we are going to classify that as partially compensated. So now I'm going to hand it over to David to discuss that relationship between pH and our values in a little bit more detail.
Now, I know you just mentioned detail, but Emily, what do you think about some mnemonics? Do you like mnemonics over here?
Ooh, I love a good mnemonic.
All right, great, because I have a great mnemonic for every listener right now. So, a great way to remember this is if there is a direct or indirect relationship with pH, there is that mnemonic Rome, ROME. First, let's review the RO part of Rome. The RO stands for respiratory. Opposite. So the R is respiratory. The O is opposite, meaning that there is an inverse or indirect relationship between PaCO2, respiratory, and pH. Now, if pH is increased, this means that the PaCO2 will be, that's right, it's going to decrease because opposite. All right, now you got the first half of Rome. Let's look at that second half of Rome. The me, M-E. Can you guess what that's going to stand for? Yeah, you got it. The M is for metabolic and the E is for equal or the same. There is a direct relationship between the pH and HCO3 or metabolic. And if the pH is increased, then the HCO3 is going to be increased as well. So that is a great mnemonic for you to understand and remember how to go about this when you have to face this in a question. So never forget ROME for Rome.
So, another great thing to do now is to make sure you're understanding all of these various steps we just reviewed. And again, remembering what is considered a normal or an abnormal range. The only way we're truly able to utilize these tools to get to the correct answer choice is by having a better understanding of what these values are and what an abnormal reading would mean. So, what I mean by that is knowing if it would make it more acidic or basic, depending on the area of abnormalities. So, this is a great time to go back and re listen to this episode, open up your notes on ABGs to further review this area because this is definitely a topic that will pop up on the boards, which is why we made this one of our mini series. Make sure you stick around for parts 2 and parts 3 of this mini series, where we'll dive into a little bit more of the signs and symptoms, causes, and treatments of some of these various conditions. So don't miss out on those episodes to come.
Now that you heard our ABG series part 1, here is a quote from Eleanor Roosevelt. Do what you feel in your heart to be right, for you'll be criticized anyway. That is right. Follow your heart. Follow your goals. That heart, it's not going to lead you into the wrong direction. People are always going to criticize you. People are going to have opinions. It is always going to get out there. Those people, those things, it's always going to try to get the best of you. But don't let it. No matter what, if you keep on following your heart, keep on pursuing your dreams, keep on going after your goals, let them criticize you. Let them make opinions about you. It doesn't matter. Forget them. Focus on you. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow. Thank you once again.